Hey everyone, welcome back. It's been a little while. Happy 2025. This week we're taking another look at the 90-90 hip lift. This is Dr. Jennifer Favinger. Grew up in Nebraska, primarily track and field athlete at the collegiate level, all the way up to the collegiate level. She's also our resident neurotherapist, primarily specializing in neurologic conditions as well as athletic sport and orthopedic rehabilitation. So what we're working on here is a couple of variations of the 90-90 hip lift. And the reason we really like this exercise, we keep coming back to it, is just because it does so much for us when we're trying to recover postural integration. We're trying to get the whole body together, and we're just trying to recover some movements that maybe have been lost due to kind of the way that life treats us, some of the patterns that you normally get into day to day. So what you'll notice here is, we got 90 degrees at the knees, 90 degrees at the hips. We got the foot contacts at the wall. Really, really important that you maintain awareness at the knuckle of the big toe and the inside edge of the heel, or even just the middle of the heel. Just make sure that we keep that foot awareness there and we don't rock out onto the outside edges of the feet. You also notice she's got a yoga ball between the knees. That's important to just very gently bring the adductors into play. We don't want to squeeze that ball too hard, maybe about a 2 out of 10 effort, just making sure that the adductors are helping us with recovering a little bit of hip internal rotation at the pelvis, at the hips, and kind of setting up the low back for more success. What you'll notice here when she does this is those hips lift ever so slightly. So those foot contacts, she's going to pull down on the wall. She's going to engage those hamstrings and use those hamstrings to lift those hips ever so slightly. So basically, just the tailbone comes off the floor. It's not the entire low back. We don't want to bridge up into kind of a mini bridge position. This is just a hip lift. That means the tailbone comes off the floor. The lower back stays flat on the floor. You'll also notice that in this variation, she is raising one arm toward the ceiling. So in this case, what we're assuming is lateralization, which means there's some kind of compensation going on from one side to the other. Now, this would be something that we would include if we had taken the time to do that full body head to toe diagnosis that we do every time you come in. And so in this case, what we would have found is maybe that left shoulder blade is kind of pinned more toward the midline, really close to her spine, and maybe she's got a lot of tightness between that shoulder blade and the spine. And so we're going to use the breath, long, slow, silent inhale through the nose, long, slow exhale through the mouth, sighing that air out. And using that breath with her arm in that position, we're going to use breath work to expand the rib cage in the back of the shoulder and stretch out that, in this case, it would be a tight muscle between the shoulder blade and the spine. It might be the rhomboids, might be the middle trapezius muscles. So that is the first exercise for now. And again, I can't emphasize this enough. The whole point here is we want to really emphasize the proper breathing technique so that we get everything out of this that we can. This is going to loosen up the mid-back. It's going to loosen up, in this case, Dr. Jen's right shoulder. It's also going to loosen up the lower back. Hamstrings are going to support the pelvis. The low back is going to go into a little bit of flexion, and that breath work is also going to loosen up the lower back muscles in this position. So next, we'll take a look at one more variation. Okay, next variation. So with this one, you can see both hands are raised. So we're assuming maybe it's not, we don't have quite so much of an asymmetry up top, but what you'll notice is there was a hip shift here. So in this variation, we're assuming that asymmetry more down at the pelvis, at the hips, at the lower back, than up at the upper body. So in this case, with both arms raised toward the ceiling, we're going to get, using that breath work, we're going to get expansion, posterior expansion between those shoulder blades in through the rib cage on both sides, pretty much equally at the thoracic spine. But what you'll see with this hip shift, so she lifts the hips, and then that right knee rises ever so slightly toward the ceiling, and that left hip, that left knee, comes back down toward the floor just a little bit. So now we're shifting the left hip back and the right hip forward and addressing the asymmetry down there at the hips and at the pelvis and at the lower back. And so again, the same rules apply. We're pulling down with both hamstrings, but once we lift the hips, we're going to lift those hips using the hamstrings. But once we get them up there, once the hips are lifted, we're going to shift the hips, pull back with the left hip, push forward with the right hip, both arms raised, long, slow, silent inhale through the nose, long, slow exhale through the mouth, sigh that air out, find those lateral obliques, improve your core stability, improve stability and mobility at the hips, and then increase that expansion through the upper back, relaxing the shoulders and even relaxing a little bit of the neck. So I hope that was helpful. If you have any questions about that, we would love to talk to you more about this. Again, make sure that you have the right diagnosis. Remember, you can kind of see how there are variations of this exercise based on your condition. We want to make sure that we have the right condition. We want to make sure we have the right diagnosis so that when you come in, if we give you an exercise, a corrective strategy to improve your posture, improve your core stability, improve your strength, that you're not wasting your time and it is the right exercise for you. All right, everybody, thanks so much, and we will see you here again very soon.